So the next one is, how do you make a diagnosis? How do you write your diagnosis of neonatal sepsis? So in writing your diagnosis of neonatal sepsis, the first point you have to bring out is you say if it is early onset or late onset neonatal sepsis. You have early onset or late onset neonatal sepsis. After saying if it is early onset or late onset neonatal sepsis, the next point you have to bring out is the you can bring out the risk factors that you had. Provided you want to speak about your diagnosis discussion, can bring out the risk factors and bring out the complication that you had in this patient. Is it clear? You can have the complication like neonatal jaundice, where you're going to have the yellowish discoloration of the skin with a different karma classification. You can have electrolyte imbalance. The electrolyte imbalance is actually what is going to result to the lethargy of the child, the irritability of the child, the lethargy of the child, and even convulsion of the child can also come as a result of the electrolyte imbalance. So a child may just have neonatal sepsis and is convulsing. Though every time you have convulsion, you must always try to rule out a meningitis by doing a lumbar puncture and CSF analysis. So the child can still convulse because of the electrolyte imbalance that is as a result of the sepsis. You have dehydration. You evaluate for the signs of dehydration in the child. Is it clear? You have also anemia. You have to find the clinical signs of anemia in the child. So those are the complications you have to bring out. If it's clearly icteric and all that, the mucosa are pale or not. You have, I've said, the signs of dehydration. You have to evaluate if the child is urinating. Is it clear? That's why the postnatal issue is very important in this case, because the child is not urinating. You are going to try to know if it is a renal failure or not, and then after that you have death. Is it clear? And you have other point of focus are going to be affected. When you have sepsis, you can have meningitis. Is it clear? Because of infection at the level of the meninges. When you have sepsis, you can have acute pyelonephritis and all that. So those are septic embolization that can result also as complication of neonatal sepsis. So that is how you write your diagnosis. Is it clear? Now, after writing a diagnosis of neonatal sepsis, you now go to the investigation and the management of neonatal sepsis.